Good afternoon, guys. Today I'll be explaining the anatomy and the biomechanical principles of an upper body exercise, upper body compound exercise, a lower body compound exercise, and an anterior trunk exercise and a posterior trunk exercise. Good afternoon, guys. I'll be starting with the anterior and the posterior trunk exercise. The anterior refers to the frontal muscles, and the stabilizer within the exercise that I'll be doing, which is a Russian twist, is the tibia, which is the second largest bone in the lowest extremity of the body. Trunk rotation is used to stabilize the body during movement. It enhances the core strength and your core muscles that help you maintain balance within your body. The joints involved are your hip, your elbow, and your knee. And the joint action for the elbow is flexion. On the hip, it is lateral rotation, and the knee, it's flexion. Now I'll be demonstrating how to do a Russian twist and the progression and the regression of a Russian twist. So progressing a Russian twist, to make it more difficult, of course, you need to be lifting your feet off the ground in the air. So lifting your feet off the ground in the air like this. You see? So it's off the ground. And regressing it would obviously to be putting it on the ground. Now your core is off the ground as well, so you're just a little bit off the ground like this, and then you're moving side to side, not moving your feet as well, keeping your feet still, and concentric movement side to side. Concentric. Another way to progress it is to have weight in your hands, also ensuring that your feet are straight, moving side to side. Okay, now I'll be demonstrating the posterior trunk exercises. The exercise that I'll be doing is a hamstring curl, which activates your glutes, your hamstrings, and your lower extremity, which could be your gastrocnemius and your soleus, while contracting those muscles as you do a hamstring curl. Now I'll be demonstrating how to do a hamstring curl on this bench over here, with about 10 kgs of weight added to it. Now there will be a progression way of doing a hamstring curl, adding a weight to the exercise. In order to regress the exercise, I would take the weight off and perform the exercise as I would have done if there was weight to it. And I'll be demonstrating how to do the hamstring curl now. But before I do so, the joints involved during a hamstring curl are your knee joint, which is your hinge joint, your hip joint, which is your ball and socket joint, and your ankle, which is the synovial joint. The actions of each joint: at the knee, it's flexion and extension. As you extend, as you're going down, over here, as you're going down, I'll demonstrate going down, and you flex it when you're contracting all your muscles. You contract the gluteus and the hamstrings coming up. Now with the ankle, it's plantar flexion because your feet are pointing downwards as you come up. And at the hip, it's extension of the hip. Now I'll be demonstrating how to do a hamstring curl. Now this is a progressive way of doing the hamstring curl because there's weight on it. So in my area, by the way, I made sure there's no obstructions around me, so if something does happen, everything's safe. Okay. So you lock your feet in here, your calves. So your calf is used as a stabilizer during this exercise, which is your gastrocnemius and your soleus. And this is contracting it now. So that this is flexion, and then this is extension. Flexion, extension. While you do this, you contract your gluteus and your hamstrings, which is the prime muscle activated during this work. You're contracting, relax. Now to progress the exercise, I'll take off the weight completely now, so now there's no weight at all, and then I'll just work on my form, the correct form. So I'll lock my legs in. And that's how you perform the hamstring. Okay, now I'll be demonstrating a lower body compound exercise. A compound exercise is an exercise that allows multiple joints to perform the exercise. It allows multiple joints to enable the exercise to happen. The exercise that I'll be demonstrating of the lower body extremity is the deadlift. The deadlift joints used during the deadlift is your hip joint, which is the ball and socket joint, your knee joint, which is your hinge joint, your elbow joint, which is also the hinge joint, and your ankle, which is the synovial joint. Now I'll be telling you the actions of these joints during the deadlift. During what the knee joint does during deadlift is extension. What the elbow does during the exercise is also extension, and the ankle, it's plantar flexion because your feet are facing downwards like that, and the hip is extension. Now I'll be showing you the progressive ways and the regressive ways of doing a deadlift, but before that I'll demonstrate how to do a simple deadlift and the form that you should have while doing the deadlift. During these exercises we need to make sure that we have balance and low center of gravity when on the downward movement, and make sure that we have balance coming up to ensure that the exercise is done to the best of our abilities and that we avoid any injuries or any muscle spasms during the exercise. Also, as you can see, my area that I've marked, is rather, oh my word, my apologies for that. The area that I've marked is rather safe, and there's nothing around it that can cause any harm. So now I'll be demonstrating, as I said, how to do the deadlift. So I'm in a simple anatomical position right now. My feet are shoulder width apart, my hands are to my side. Now I need to get a shoulder width grip on the bar. You come up, you contract your hamstrings, your gluteus, and your deltoids, and your upper trapezius. And you go down and you relax it, and then you come up, locking your knee joint, elbow extension, hip extension, and then you go down, and you come up. Ensure that coming up, it's plantar flexion as well at the ankle, which is the synovial joint. Now, a progressive way of how to do a deadlift, obviously people increase the weight. Now, if I want to regress this exercise, I would take it off. Take the weight off. Take the weight off. Now I'm just using the plain bar. Now the same movement, anatomical position, shoulder width apart. The grip on the bar will obviously also be shoulder width apart. Now I'm just making sure I get the right form. Up, contracting your upper trapezius, your deltoids, your hamstring, locking your knees. So your knee joint, which is the hinge joint, is extended, and your elbow is also extended at the joint, which is also your hinge joint. Plantar flexion is taking place, and everything is contracted right now. When you're going down, everything's relaxed. And that's the regressive way of doing the exercise. Also, slowing down the movement for progression during a deadlift is also important, as that allows more concentric movements to enhance the exercise, which makes it more effective. The more concentric your exercise is, which is more slow, of course, and it contracts the muscles, which allows for better results from the exercise that you are doing. Another way that you can regress a deadlift is having a kettlebell off an elevated surface using a bar without any weight to do the exercise. Now that's the way that I learned recently. So using a kettlebell, or but I don't have a kettlebell right now. But I will demonstrate something that can be of the same use. So just say I had like a bench here now, and this was the kettlebell, like over here off the elevator. So the bench is here off the ground. Now the kettlebell will be here, so I'll be holding it like this, and then I'll be stopping there. So that's a regressive way of doing a deadlift as well. Thank you. Hi guys, my last exercise will be demonstrating how to do a shoulder press. A shoulder press is a upper body compound exercise. As I explained in my previous videos, a compound exercise is an exercise that involves multiple joints to perform the exercise. Now, the shoulder press, what it targets is the deltoids, the tricep brachii, and the upper trapezius. It is also involved as the scapula moves with the humerus during the upward motion and the downward motion as the scapula moves, just like that. Now, when the weights are pushed up during this exercise, as I'll be using a barbell, as I'll be showing you later on, when the weights move up like this, so coming down and going up, when the weights move up, it is called the concentric phase of this exercise. Now, the joints involved, as I said, the shoulder, the elbow, and the scapula. Now, the actions for these joints are, at the scapula, it's lateral rotation. For the shoulder, it's shoulder abduction because it's moving away from the midline of the body. And for the elbow, it's elbow extension, as the elbow does extend going up, and then it like shortens coming down. Now, abduction, as I explained, is the movement away from the midline of the body. Now, remember, during this exercise, you need to ensure that you have the correct form. Otherwise, the exercise will make you have an injury or allow for certain things to happen that are not supposed to happen. So you need to ensure that you have the correct form. Also, your area that you're working in needs to be safe and secure so that you can do the exercise to the best of your ability. Now I'll be explaining the progression and the regression of this exercise. For progression, you need to add weight or increase the reps with less weight. So you increase the reps with less weight. Now, also another progressive way is focusing on slow concentric movements. So moving it as slow as possible, which will activate your muscles more efficiently than doing it fast. And the regressive way of doing this exercise, which I'll demonstrate, is finding a platform, or like in my instance, I'll be using the wall as a surface to move off the bar. So you'll be using that as a guideline for the bar so that the weight is not fully shifted onto you as you do the movement. That's a regressive way of doing the exercise. And now I'll be showing you how to progress the exercise. So the progressive way, I'll be using weight, as I said. So I'll be starting off here. So elbow extension, the scapula is moving. Now you come down here, we'll hold it here. You go back up, elbow extension, coming back down, you go back up. As it attacks the deltoids, your upper trapezius, and your tricep brachii when extension takes place. Then you come back down, and then your scapula is activated during this movement and your humerus. You go back up, come back down. Now to regress this exercise, as I explained previously, I would take off the weight, of course. Taking off the weight, now I'm using the bar again. Start here, an upward movement, come down, I'll stop here, and I'll go back up with the elbow extension. I'll come down, and I'll go up. And then, as I said now, with progressing this exercise as well, we need to ensure that we do concentric movements that allow for better muscle activation, which will definitely activate your tricep brachii, the deltoids, and the upper trapezius during this exercise, and it will also help your scapula and your humerus during this exercise to be activated in a better way, which will prevent injuries as well. Now I'll be demonstrating another way to regress this exercise, which will be against the wall. So now against the wall, like this. So I'll be holding it here, starting upward phase. I'll start here. So this guides it to do the exercise for you, so that the weight is not fully shifted on your body, and that you don't have strain on your upper trapezius, your deltoids, and strain on your tricep brachii as elbow extension takes place. So this prevents all of that. Thank you.